Okay, so the new chapter is chapter 5. No, chapter 4, I'm sorry, which is basically anatomy and physiology. Now, how many of you actually have, let me see if I can enlarge this. Since I got some stuff. Have taken anatomy and physiology before? Okay. Well, no, actually, that's chapter 5. I'm sorry, I tried to open up chapter 4. Let me see if I can get rid of this. That's pathophysiology. You guys need to know, the anatomy and physiology, which is basically the location of the organs, places. Let me see. Location of the organs, uh, the structure of the organs, and also what they do. That's physiology. That was chapter 4. There you go. Okay. There you go. So, am I missing something? Hold on. That's not the next chapter. I might have downloaded the EMT basic level one. Nope, first responder. Okay, well let's go. Well, this is the next chapter anyway, chapter 4, which is basically obtaining a history and vital signs. Find you guys again. And we did finish chapter 3. Okay. And the reason I put this one by itself, because it's got a lot of what do you call it? Of the breakdown of what anatomy and physiology is. But not only that, it also has the breakdown on body positioning and everything else that we need to know in order for us to actually get this. Now, I'm going to tell you a secret, guys. When we're dealing with a history, obtaining a medical history, we have some acronyms that we use, so that way we don't forget. One of them is sample, and we're going to be going over this eventually within the next few chapters. Actually, we're going to be going through this throughout the whole course, but sample stands for signs and symptoms. And we'll go over what signs and symptoms actually means. Allergies, which is very important because some of the stuff that we actually give the patient, they might be allergic to, so we don't want to detriment the patient itself. Medical history. No, I'm sorry, it's not even medical history. It's symptoms, allergies. Yeah, it's medical history. Sorry. T is past pertinent, and basically the P that what it means is, if I ask somebody, well, do you have any past medical history? I'm sorry, this is not. This is what I remember. I'm sorry, I just remembered, and not everybody's perfect. Don't get me wrong, they keep on reminding my kids and my wife keep on reminding me of that. But M stands for medications. Any medicines that might actually be taking. Now, I'm going to tell you, medications are a cheat sheet note for you, because if a person's taking diabetic medications like insulin, the other one would be glucophage, also known as metformin, or any type of glipizide or anything like that. Those medications would dictate to you that they're taking them because they have a medical history of diabetes. If they're taking hypertensive medications, then they might have a history of hypertension. So they're like cheat sheet notes. So that's why we ask, that's why you have to ask these questions. And of course, the P is past pertinent medical history. And what that means, if I write it down, past pertinent medical history. Now, I'm going to tell you something. If you ask a patient, do you have any past pertinent medical history? That indicates that you're asking him, do you have anything that's, what do you call it, pertinent to the condition that you're suffering right now? Of course, he can turn around and say, you know something, when I was 4 years old, I had an ingrown toenail. Would that be considered a past pertinent medical history? No. Or they tell you, you know something, when I was 2 years old, I got a cold. No. But if they tell you, as an example, I had heart surgery about a year ago, then that is past pertinent medical history. Okay. The L stands for last oral intake. Okay, the last time that they ate something. And E stands for the events that happened. So if you ask for the events that happened before they got into this condition, were you running before you got your chest pain? Or what do you call it? Or just sitting down before you got your chest pain? That would dictate that they might actually have, let's see, a chest pain basically by definition stands for, could stand for, stands for, let me just get this, for what do you call it? Angina pectoris. Angina pectoris basically means chest pain, or choking of the chest. Now, were you sitting down doing nothing, or were you exercising when you got your chest pain? That would dictate that it's a stable angina pectoris, which basically you were doing something, you took some pills and it went away, or you weren't doing nothing, which is basically would state that it's unstable angina pectoris. So this is just a little bit of the examples that we go through. So medical terminology, which is very important when it comes to medical. I'll go over the other histories when we get to them. But medical terminology is the language that all medical personnel talk. So, and just to give you an example, I remember while I was working in EMS, we went to a specific hospital in Mission, and I remember that there was when we came in, we had this girl that we picked up that had fallen down and fallen on a board, a piece of board, and between her legs. So she was in pain. But when we told the nurse, she fell on a piece of board, and she has medial pain to the abdomen area and also to the genitourinary area. So, of course, she turns around and tells the doctor she got a boober in her coochie coochie. Now, I laughed because that's not what I told the nurse, but that's also not medical terminology. Coochie coochie is not a medical terminology for vagina. Sorry, but I guess everybody understands what it is, unless one of you doesn't understand what it is. So basically, medical terminology is the language that we talk to with everybody in the medical field. So there's two categories of medical terms. Descriptive, which is a term describes the shape, size, color, and function, and the eponyms. Okay, three parts of the term itself. We have the root word, which is basically the middle portion of the word. So I'm going to give you an example. Let me see if I can write this. Let's see. Let me see. Hepatitis. You guys have heard of hepatitis, right? So hepatitis can actually be broken down in the root word, which is basically hepato. Hepato means liver, and itis is the suffix, okay, and it means inflammation. So basically, this word means inflammation of the liver. So this would be liver, hepato. I'm sorry, I can't write correctly. And itis, which is basically means inflammation. God, I can't write with this mouse. So let me give you another example. Rhinitis. And most of you get rhinitis during the winter months. And all it is rhinitis basically means inflammation of the nose or the nose structures. Rhino means nose. And you can actually things because whenever you see a I was going to say rhinoceros, basically, you know that these animals have a big humongous horn, which basically looks like the nose. So rhinitis, rhino means nose, itis means inflammation. Another example would be cardiomegaly. Or I like to say cardiomegalia. And all that means is cardio is heart, and megalia means enlargement. So that means it's basically an enlarged heart. So basically, we do have to memorize some of these words for the simple reason that we don't make these things up. Now, we also have abbreviations for a lot of these, but we're not going to get into the abbreviations associated. There's a list of words on tables, I'm sorry, 4.1, 4.2, and 4.3 in your textbook. Okay, so now something to think about, why is it useful to learn medical root words, prefixes, and suffixes? Well, because that's the way all medical personnel talk. Okay, so you'll be able to communicate with them. Let's see if I can find that. The other one would be you have a patient with a history of endocarditis. Okay, what do you think the condition involves? Endo, there's now in this one you do have a prefix, a root word, and a suffix. Let me see if I can write this one out. Endocarditis. Okay, so endo, cardio, and itis. We know that itis is inflammation, right? I'm just gonna inflammation. Cardio means heart. No, I'm not in a restaurant. And endo means within. So endocarditis is an inflammation of the inner lining of the heart. Okay. What might cholecystectomy involve? Have you all ever heard of the word cholecystectomy? Oh, hold on, I got rid of my pen. There's prefix. Oh, I'm sorry. This I cut it at the wrong place. Let's see. Okay, so basically, Kali means what? For those of you that have access to your book. Well, Kali is basically the sac. There's a little sac, or this is the liver itself, and there's a little sac right here that the liver drains bile into. So Kali basically means gallbladder. Okay. Cysting is the cyst itself, and ectomy is surgical removal. So it's a surgical removal of your gallbladder itself. I think somebody's typing something on. Hold on. Okay. Okay. So basically, it's not hard. You just need to memorize the words so that way, whenever they tell you something like this, you at least know. Now, have you all ever heard of the word? Hold on. Let me just see. Have you all ever heard of the word of endocarditis? No. I'm sorry. We just went over endocarditis. Gastroenteritis. Gastroenteritis. Gastro. And I can guarantee you, some of you have actually had it. Somebody just left a message. So this gastroenteritis. Oh, I can't get rid of this. So gastro is the gastrointestinal system. Entero is within, I'm sorry, and itis is inflammation. So as a doctor, you come up to me with severe stomach pain. I can't tell you you have a tummy ache and then charge you $75 per visit. Okay. What I can do is I can tell you have a mild case of gastroenteritis. You won't know the difference, and I can still charge you $75. Okay. Positioning and directional terms. Now, this is very important because you guys are the first responders, the first people that get to see a patient. So we're going to go over some of the stuff on how to actually name the positions that you find these patients in. So anatomy is the study of the structures of the body. Okay, so the heart, the liver, where it's located and whatsoever. Uh, Also the lungs, blood vessels whatsoever. Anatomical position is the standard reference to position of the body in the study of anatomy. So the heart's retrosternal, slightly to the left. The lungs are bilateral on each side of the medial line of the chest. And then, of course, we're gonna, we deal with the location and what they look for. They look like. Now, when you're talking about somebody that you are trying to refer to as into the anatomical position, basically everybody, you have to picture them like this, so you don't confuse left from right, or right from left, up from down, or whatever. So basically, the anatomical position that you have to imagine somebody is the body standing erect, facing the observer. In other words, like if they're facing me, arms are outward, down at sides, which the palms are basically facing forward. So then we can divide the body into right and left. Always describes it from seeing when the patient's condition, so you don't get it confused. And basically, this, what you see here, is the anatomical position. Remember what it said. Body standing erect, facing observer, arms down, and palms facing outward. So this is whenever you see somebody, this is what you have to picture them in. Even though they might be turned around or whatsoever, if the laceration is right here on this leg, okay, which is basically, let me see if I don't know if you guys can see my arrow, but let's see, they have a laceration right here. Okay, you have to describe the laceration. Is this the person's right leg or left leg? If you notice this. Okay, is this the person's right side or left side?
Left.
There will be the left side. So left upper leg. Okay. So you divide the body into right and left side. But in the view of the patient, not on yours. Okay. Get rid of this. Let's get rid of this.
Would it be okay to say the left quad?
Yeah, because that's where the muscle is located at. That's another way of actually mentioning it too. And I think there's different ways that people will understand it. You can say upper leg, quad. You can actually say, actually, it doesn't come, like when you're talking about the arm, there's your arm, and there's a forearm, and then there's the hand. Okay, and usually it's depending on where you divide these things. Remember that anything that's going away from the body will be considered distal, and anything that's close to the body would be considered proximal. Okay, now anything to the side of the body, this would be the left side, this would be the right side, would be lateral. In other words, this section right here, I don't know if you can actually see that since it's dark. Let me see if I can change the color. Yeah, it doesn't give me the option of changing the color. Wow. Oh, it makes, this might be a little bit better. Okay. So you get to see this side right here would be lateral, and it's the same thing as this right here. This is the lateral. Now, anything towards the middle would be medial. So medial towards the middle, lateral towards the side. And that's in every part of the body. Like right here, if you're talking about the arm, at this section right here, that would be the lateral section. But if you're talking about the inner portion of the arm itself, or the leg itself, would be medial.
Okay, and explain again the front and back I get cut. I got cut off a little bit.
Okay, the front and back. Oh, I actually haven't gone over the front and back. Let me see if I can erase this. When we're talking about front and back,
Wait, you mentioned something like facing you or facing away from you or the body or whatnot.
well, yeah, I understand. Give me a few seconds there. Now,
Okay.
if you're dealing with the front and back, there's two different terms we can use for each one. Ventral, okay, would be towards the front. And unless you guys are fishermen or have ever taken an ichthyology class, which basically means the study of fish, you know that fish have ventral fins towards the front. They got two little ventral fins in the front, and then they have a dorsal fin. The one that you get to see the sharks facing. So, you know, whenever a shark is coming to you, they show you their dorsal fin. So they have ventral fins and dorsal fins. So in the human body, the anterior or the front part would be the ventral. Okay, it equals the same thing. Ventral and anterior means the same thing. Now, when we're dealing with dorsal or posterior would be the back part of the body. Now, think about this. Think about this. You're a guy from the 1900s and you talk properly, and you see a woman pass by, and then you look at her, and you're gonna tell yourself, "Isn't she's got a good posterior?" So, I mean, I don't know if anything else is gonna make you remember it, but remember, posterior is towards the back, and anterior is towards the front. Dorsal means to the back, and ventral means towards the front. Now, of course, superior is to the top, and inferior is to the bottom. Okay. Now, plantar means basically the bottom part of the foot. Well, palmar means the palm of your foot, of your hand, not of your foot, of your hand. Oh, guys, please don't get those confused, especially when you go to the hospital. I heard one medic actually telling that the person had gotten a cut in the palmar section, and everybody was looking at the arm, at the hand itself, right, at the palm section of the hand, and they actually had gotten a cut on the palmar, on the plantar, with the palmar. So, yeah, it happens. Now, anteriors, front of the body or body part, posteriors, back of the body or body part. Then we're talking about midline is towards the middle. It's an imaginary vertical line used to actually divide the body into right and left halves. And medial is towards the midline of the body. Remember, midline is an imaginary line. You get to see this, they have a medial line right here towards the middle of the body, or the midline. While medial is towards the midline of the body. Okay. And whenever we're dealing with anatomical terms like this and describing like a gunshot or whatever, it's very important. Okay. Lateral is away from the midline of the body. Superior is towards the top, inferior is towards the feet, and proximal is close to the torso itself. And distal would be away from, farther from the torso. Supine is lying. Now, these are terms that you're gonna be dealing with, because you're gonna find the patients lying down on the floor. And we're talking about supine is basically lying face up. So if they're facing up, that basically means that they're supine. If they're facing down, that means that they're prone. So supine and prone basically means the way you find the patients. Now, there's another way you can find the patients on their side. So they can actually be lateral recumbent. Okay. Basically, and this is what we talk about, what it's referred to as a recovery position. And it's referred to as a recovery position because whenever we have more than one patient, we have to put the patients on one side or the other side in order so they don't aspirate or swallow in blood or a lot of secretions from the mouth into their lungs. So we put them on their side so they can actually drain to either the left side of the cheek or the right side of the cheek. And we're talking about facial cheeks. Okay. So it basically means that it's lying on one side, depending on it's on the left side or right side. So remember, distal is away, supine is lying face up, lying down is prone. And we're gonna give you some pictures. I'll show you some pictures of this. And the recovery position is either to the right side or left side on their lateral side. Okay. Semi-Fowler's position. Now, semi-Fowler's position is referred to as how we actually put our stretcher. Okay. And the semi-Fowler's position basically means patients sitting up at an angle. Now, there are two. Give me a few seconds. Let me draw this so you can know this better. Where is my pen? There you go. When we're dealing with a stretcher, you can actually have the stretcher like this, or you can have the stretcher like this. So a semi-Fowler's position is at about a 45-degree angle. Okay, so this semi lying down, but the head slightly elevated, about 45 degrees. A Fowler's position would be 90 degrees. Now you wonder, well, why is it that we're actually putting a patient straight up instead of semi lying down or just completely lying down? Well, sometimes when you develop fluid in your lungs, the patient will not tolerate sitting, lying down. So you have to actually put him in the position of comfort, which is this, the semi-Fowler's position, as opposed to the Fowler's position, which is this, 90 degrees. Now, Trendelenburg's position. Okay, patient supine at an angle with the feet elevated. So basically, a lot of times when we're dealing with somebody that's going through shock, the stretcher, you're going to have the patient lying down with feet elevated. Okay. And let me redraw this. I'm sorry. Because a lot of times what we do is what I've done in the past, even in the hospital, I'll put something on the bottom. So basically, you have them on a backboard, a rigid board, and they're basically like that. So that would be the Trendelenburg's position. That way, if the person's lying down like this, all the blood that you think, let's make this guy kind of chunky. That's got a little head. Anyway, so basically all the blood that's supposed to be in the feet is now going to the vital organs because you actually elevated the feet or, the feet in the body, but in a straight position. When we're talking about the shock position, basically it's like this. Right at the hips, you straighten them out. So it's elevated right here at the hips. While this other one is the whole body is elevated, facing down. It gives you the same thing, but this is considered the shock position right here. And this is considered the Trendelenburg's position right here. Now, eventually, if I'm in a bad mood, I'm going to ask you to spell out Trendelenburg's or learn it. I know that's one of the first things that you're going to have problems with is pronouncing it. The second thing is spelling it. And I'm going to tell you something. You're going to have to spell it in your reports. So Trendelenburg's position, remember, is the whole body elevated with the feet up, at the hips up and everything, as opposed to the shock position, which is basically right where the hips are, you elevate their legs. Does that make sense? Or are you guys getting discouraged from taking this class? This is a learning process, guys. So if you haven't heard of it, this is where you're going to learn it. Don't expect I watch House MD and I know everything about medicine. It doesn't happen that way. Okay. So at this point, what position is this guy in? Lying down, facing up. Let's go over the terms again. Okay. Lying down, facing up, so he's in the prone position. Or would he be in the supine position?
Yeah, that's fine.
Supine position because
Supine.
he's facing up. If he would have been the other way, it would have been prone. Now this guy is in which position?
Prone.
Prone position. There you go. See, it's not hard, guys. But just wait. What position is this? Let's go back to the terms. The recovery position, also known as the lateral recumbent. Person's lying down. Now, normally what we do, so they don't flop over, we bend their knees so we can use it as like a kickstand. And if they're vomiting or whatsoever, they're vomiting outside. Or they're bleeding in their mouth, they're bleeding towards the outside. They're not, if they would have been in this position right here, the supine, they've been swallowing this blood and it goes straight into the lungs, and that's a different animal right there. So this is a lateral recumbent. Now, women that are pregnant in their third trimester, you always want to have them on their side because the weight of the baby compresses against the blood vessels in the back, and it causes another form of condition. And we'll go over those when we're dealing with OBGYN. So a pregnant woman in the third trimester is always left lateral recumbent. And the reason you put them on the left lateral recumbent as opposed to the right lateral recumbent, because if you put them on the right lateral recumbent, they'll be facing towards a wall and you won't be able to see them. But if they're facing left lateral recumbent, they're facing you. Okay. Now, what's this? Is this a Fowler's or semi-Fowler's? Is this guy at a 45 degree or at a 90 degree?
45.
45, so they're about at a semi-Fowler's. This person here is in the Trendelenburg's position. If you notice, they're on a backboard and they elevate the feet and the whole body is actually coming down this way. So they're in a Trendelenburg's position. Bent at the hip and knees, this is the shock position. And I can tell you she's got allergies because she's got an EpiPen.
Yeah, yeah. ¿Qué es el password? ¿Carnales qué? ¿Del Wi-Fi? 19?
Okay, positional and directional terms. Think about it. Why might the use of a positional and directional terms be important? Because you can describe how you found the patient or how you place the patient when you're transporting him. When might using a simple terms be more appropriate than medical terminology? Now this is easy because you guys are at a learning process right here. When might using simple terms be more appropriate than medical terminology? And it's easy. Remember, I gave you the example of gastritis or gastroenteritis. When you're talking to the patient and you tell them you have a mild case of gastroenteritis, they don't know what the hell you're talking about. because you learned it. Unless they're in the medical field, you learned it. They haven't. And I'm going to give you an example. When I was a doctor, a student doctor in Mexico, a patient came up to me, which I thought it was kind of weird. And she tells me she's got problems. And I'm going to tell, I hope that all of you understand Spanish. Tengo problemas con mi mariposa. So I'm thinking, is like, what the hell's a mariposa? I'm thinking butterfly, right? And I think I've also heard que tengo problemas con mi vaso. And I'm thinking, like, what the hell? And I would turn around and look at the nurse again. I don't know these terms. But these are terms that they learn. Mariposa basically means your thyroid. Vaso means the upper section of your stomach. Vejiga is basically your bladder, which I had to learn medical terms in their point of view. So the question is, why might it be simple for you to actually use simple terms when you're talking to patients? If you go up to the patients, like, well, you know something, do you have any pertinent past medical history? They're not going to understand what you're asking them. Okay, you do, and everybody else in the medical field does, but they're not going to understand. So you have to tell them, you know, have you had any recent surgeries or anything that you might want to talk about that you visited the hospital for or they diagnosed you with? I mean, it's just the way it is with patients. Overview of the human body. Basically, physiology is a function of the body and its many systems. So physiology is the function, anatomy is the location and structure of. Okay, you have regions of the body, you have major internal structures and general locations of each, and you have 4 major body cavities: the cranial, the thoracic, the abdominal, and pelvic. And we'll go, hopefully, I think I might have a picture of that in just a little bit. But basically, when we're talking about the regions, it's like right here, most common, the umbilical region, which is basically the belly button region. Inguinal is the inguinal, region will be above your genitourinary, and genitals will be your private parts. Femoral regions named because of the femoral bone. Okay, and the arteries are also named, on that. Of course, you have the arm, and then you have the forearm. The arm would be the upper section of the arm. The forearm would be the lower section. Of course, you have your hand. The thoracic region basically is the thorax, which is basically the upper chest. And right here, when they're talking about this little section right here. I'm sorry. Right here, right when you fold your arm, there's like the little crease that the bend area of your elbow does on the opposite side. It's called the cubital region. Okay, the flank would be towards the sides. Then of course you have your scapulus, and anything that's the bottom of something would be considered inferior. Cervical region is because of the cervical spine. Occipital region would be the back portion of your head, and the cranial region would be everything else. Of course, you also have here that they don't actually explain is the facial region. The facial region is where your face is at. The thighs, of course, then your legs, and of course lower extremities also. The popliteal would be the back part of your knee itself, the back portion of it. Popliteal is because you have a popliteal artery right there that we actually look for to find out if you have a pulse in there or not. These are the cavities themselves. So you have the cranial cavity that houses the brain, the thoracic cavity that covers the heart and the lungs, the abdominal cavity that deals with the stomach, the liver, and the gallbladder. You also deal with the spleen, and your large intestine and small intestine. Of course, you have your pelvic cavity, which deals with your bladders and your genitourinary system. The cranial cavity houses the brain and its specialized membranes. And when we're talking about the membranes, there's 3 of them: the pia mater, the dura mater, and the arachnoid membrane. Pia mater basically is the internal. If you think about it, it's like a lining that the brain has. So let's say you have your brain. Okay, the layer that's closest to the brain itself is called a pia mater. The middle one is your arachnoid because it looks like spider webs, and then the outer would be your dura mater, which is basically means tough mother. Oh, wrong eraser. Okay. The thoracic chest cavity encloses the rib cage, is enclosed by the rib cage, and holds and protects the lungs, heart, great blood vessels like the aorta, the vena cava, and all those, and part of the windpipe, which is your trachea, and part of the esophagus. Of course, you have your diaphragm, which is the lower section. The diaphragm itself here is that little section right here that you see kind of like in a pink area, right below the light pink. This is darker pink or reddish area. The diaphragm itself is a muscle of respiration. We need it for it to breathe. And then you get to see a bit, you get to see it right here. I don't know if you can see this, but you see this muscle right here? When it contracts, it gets straight and it pulls down so the lungs can actually come in, can expand and air comes in. Of course, you have your ribs. You have your lung tissue, the heart itself. Of course, this is the middle portion, which is a sternum, the esophagus that goes all the way to the stomach. Then, of course, you have the bones, which is the sternum is connected to the clavicles themselves. The clavicles connected to the well, I can't show you this because I need to have the back portion of it. But it's the scapula itself. And let's see what else. Of course, in between the ribs are muscles. So, of course, your heart's located right here. Retrosternal slightly to the left. Now, at the end of the abdominal cavity lies between the chest cavity and the pelvic cavity. Okay, it holds the stomach, liver, gallbladder, pancreas, spleen, small intestine, and most of the large intestine. The pelvic cavity protects the bone. Is protected by bones of the pelvic girdle, which basically your hip bones. It houses urinary bladder, portions of the large intestine, internal reproductive organs, and that's it. So we can actually make the division right where your hips are. That's where we actually make that division. So here's your liver, your stomach, your spleen is somewhere hidden back over here on this side. Okay, you have your large intestine, then you have your small intestine. And of course, we're also dealing with the pelvic cavity, which starts where your hips are at, and it houses the bladder. It doesn't house the kidneys. Kidneys are located in the back portion of your body, and they're like a little bit higher up than this. Abdominal quadrants, and we use these quadrants to actually define injuries or locations of certain organs that we have. You have the right upper quadrant. Now, so of course, if you see this, find the belly button. Let's say the belly button's right here. Find the belly button and basically divide it in two. 4 regions, which are the quadrants. So you have the right upper, left upper, right lower, and left lower. Okay, and that's basically how you actually define some of the organs that we have in there. So let's go back to this. So the right upper quadrant, you have the liver, gallbladder, part of the small intestine, part of the large intestine. So the right upper quadrant, you have your liver, okay, part of the large intestine, part of the small intestine, and the gallbladder, which is hiding behind the what do you call it, the liver itself, on the bottom of the liver. Left upper quadrant is the stomach, spleen, part of the small intestine, and part of the liver. So the liver is located on both upper, right and left upper. So right here, we're dealing with the spleen itself, the stomach itself right here. And then we're dealing with part of the pancreas, which I believe at this portion, the pancreas is more retro or towards the back. So okay, and then you have the right lower quadrant. You have your appendix, part of the small and large intestine, and the left lower quadrant, which is part of the small intestine and large intestine. So when we're dealing with this one, you have your what do you call it? Appendix, part of the large intestine and part of the small intestine. And then this opposite side, which is the right side, or the left side, I'm sorry, would be your large intestine, small intestine. One better picture than I drew. So the liver is the majority of the body. I mean, of the majority of the liver is located in the right upper quadrant. You also have the right kidney, which is towards the back, but you know it's more retroperitoneal. The pancreas, which is the pancreas, is right here, right a little bit behind and below the stomach itself. You don't get to see it in this picture. Let's see. You have the diaphragm, which is the muscle of respiration. You get to see it in red here. And then on the left side, the left upper quadrant, you have the spleen itself, somewhere located in this region, the left kidney, the stomach, the colon itself, which basically, once your large intestine ends up over here towards the back, it goes slightly up, and then it becomes your poop chute or your rectum. You know, most of the small intestine. Okay, the right lower quadrant itself, you have the colon, small intestine, right ureter, and the ureter is the tube that goes from the kidneys to the gallbladder. You have 2 ureters and 1 urethra. The urethra is from the bladder to the outside. So right ureter, appendix, right ovary in females, and right fallopian tubes in females. Guys, you don't have an ovary. Sorry. Your ovaries became testicles, so through a process. Okay, so then you have the colon itself, small intestine, left ureter, left ovary in females, and left ovary fallopian tube in females. Now, we do have to define the difference between a solid organ and a hollow organ. A hollow organ is something like a tube, like the large intestine, small intestine, the gallbladder, anything that has a space in between. And organs that don't have it, like the liver and the kidneys, are considered solid organs. How might knowledge of the body cavities and organ placement assist you in assessing a patient with a stab wound? And well, you know, if the person got stabbed, let me see if I can. There, right here. If the person got stabbed in the thoracic region, well, you know it's going to affect the heart and the lungs. It doesn't affect the liver. That would be more abdominal. And they actually show the gallbladder right here. And this tube from right here goes, comes in from the liver. This side comes in from the liver, and this one goes into the second portion of the small intestine. And abdominal pain. The same question: how might the knowledge of body cavities or organ placement assist you with assessing a patient with abdominal pain? Well,
No se conecta. Está conectado, pero no lo abre.
so let's see if the person has pain to the right lower quadrant, you have to suspect appendix, as opposed to if he has it on the right side or the upper sections. Body systems. Respiratory system, you have the upper airway, nose, mouth, and larynx. So our mouth is part of the what do you call it, the respiratory system, because, I mean, I hate to say this, but some of you are mouth breathers as opposed to nose breathers. Of course, you know, this is one word. It's not nasopharynx, it's nasopharynx. And then you have in the mouth, oral means mouth, so you have the oral pharynx. Nose means nasal. And the larynx itself is right where your windpipe is located at. Sorry, the back portion, let me see if I can get back to this one. And the back portion of the airway. So if I show you a picture, let me see if I might have a picture of it. Of the nose section. So the respiratory system consists of this is the upper airway. Consists of the nose.
Connected, but doesn't open a browser.
And the only reason I want to consider this as the upper airway is because you have to define whether you have let's say an upper respiratory infection or a lower respiratory infection. Medications are different for those, especially the antibiotics. The lower airway, anything below the trachea, lungs, bronchi, bronchioles, alveoli, and associated muscles themselves, which is your diaphragm, your intercostal muscles, and whatsoever. So right here, at this point, where you get to see this, where you see the larynx, that's the division between upper and lower airway. So the upper airway would be the nasopharynx, oropharynx, and the larynx itself, and the lower airway is the bronchioles, trachea, lungs, and associated muscles. These are the alveoli. Now I'm gonna tell you, the only functional unit in the lungs is your alveoli. The only thing that has a function in your lungs, because your lungs are just basically, all they are is just, what do you call it, sponges. They don't expand by themselves. They don't do anything. If you take a lung and lie it there, it's not gonna do anything. But because of your intercostal muscles, in other words, the muscles that are between the ribs and your diaphragm, your lungs actually stretch out. When they stretch out and cause air to go in, and we're trying to get in air all the way to your alveoli. Right here. And these like little grape clusters. Okay, the respiratory system, the functions, exchange of oxygen, carbon monoxide. That's not carbon monoxide, I'm sorry. Carbon monoxide is what cars release. So Let me fix that. It's carbon dioxide. Oh, sorry. Wrong eye. So it's oxygen and carbon dioxide, and it warms, filters, and moistens the air, and also minimizes possible aspiration. Complications, perfusion adversely affecting patients is not breathing adequately or stop breathing at all. Diseases and injuries disrupt delivery of oxygen from the outside of the body to the individual cells in your body. Every cell requires oxygen, guys. Cardiovascular system is the primary function or structures of the heart, blood vessels, and blood. And when you talk about this, you have the heart itself, which is the pump, blood vessels is the tubing, and the blood is the fluid inside the tubing. There's two sides of the cardiovascular system. We have the arterial, which carries oxygen, blood to the body, and the venous system brings it back to the body. Or to the heart, I'm sorry. Functions, the circulatory system carries blood and other nutrients to body cells. It assists with removal of waste and carbon dioxide from cells. Complications, you have dysfunction of the structures leads to poor perfusion and buildup of waste products. And the cardiovascular system consists of all this. Now, this is nothing because the blood vessels are, if you actually look at a body with actual blood vessels, this doesn't even give it a, what do you call it, a correct picture of it. So remember, you have the heart, which is the pump. You have the blood vessels, which is your arteries, which are thicker in wall as opposed to the veins, which are thinner in the wall. Also, some of the veins have valves themselves, as opposed to arteries that don't. Okay, and usually veins bring blood back to the heart, while arteries take it away from the heart. The capillaries is in between the veins and we call it the arteries themselves. And if you really think about it, they're very thin walled. So carbon dioxide and oxygen and nutrients escape through the walls and go affect the cells that it's close to. The heart itself consists of 4 chambers. And when I draw the heart itself, I normally learn how to draw it differently. So the heart itself has 4 chambers. Two upper atria, left and right. And then 2 lower ventricles. So the upper 2 chambers are atria, and atria, by definition, receive blood. The right side receives it from the body through the vena cava. You have the superior and inferior vena cava. And the left side atria receives it from the lungs. The ventricles push blood out of the heart. So the atria receive it, and the ventricles push it out. Okay? And the right side sends it directly to the lungs so they can get oxygenated, which then comes back to the left atrium. So then you have the left and right, which is left and right ventricles, and the right ventricle takes blood to the heart, while the left ventricle takes it throughout the whole body. And usually the left side is stronger than the right side because it has to push all that blood all over the body. So if you notice on this picture right here, look at the difference between the wall here and the wall here. It's a lot thicker on the left side. So that tells you that the left side requires more oxygen, and most heart attacks are going to occur in the left side. Okay, now, some of the structures, you have the aortic arch right here. Let me see, okay. I'm not going to draw on this one, I'm just going to put the aortic arch, your aorta itself. Then you have your vena cava. This is superior vena cava, and this is the inferior vena cava down over here. And both the inferior and superior drain into the right atrium. And if you're a blood vessel, the right, you're gonna come in from the body, the upper part of the body or the lower part of the body to the right atrium. Then you're gonna be pushed through a valve. Okay, this valve right here, okay, it's called a tricuspid because it's got 3 cups. And these cups are attached to the wall, the inner wall of the heart itself, and these are papillary muscles attached to cordia tendineae. And the white portion that you see here is cordia tendineae. And cordia tendineae basically are cords. So when the atria contract, they push blood in to the ventricles, and they have to go through the valve itself, which is the cordia tendineae. Of course, you have on the once you get to the right side, this blood vessel that's right here is going to shoot out to the semilunar valve right here, which is a pulmonary semilunar valve, which basically means it's going to go to the lungs. Pulmonary means lungs. So it's going to go to the pulmonary blood vessel to the lungs, and then it's going to come back. It's going to come back to the left atrium right here, which atriums receive blood. The thing is that the right side receives it from the body, upper and lower, and the left side receives it from the lungs. So it's already oxygenated once you get here. And it goes to another tricuspid valve, and then it's pushed out to the vena cava and the rest of the body. Don't worry, you'll eventually get it. I kind of explain it easy, try to explain it easy, but I forget that sometimes I don't make any sense. So I hope I made sense this time. Yeah. In the structures, you can see it a little bit better here. This is like a parachute. And right here, what you get to see in the inner portion of the ventricles, these little muscles that are attached to this tendon, okay? And this is the papillary muscles on either side, attached to the cordia tendineae, which basically is attached to the valve itself. So remember, the right side has the tricuspid, and the left side has the bicuspid. Now, this is the conduction of the heart. The electrical conduction starts off right here, which is the sinoatrial node. Okay, and then it goes to both atrias before it gets to the bundle of His. Okay, and it's a bundle of His because it doesn't belong to her. Come on, guys, you have to have a sense of humor. So basically, at this point, you have the sinoatrial node sending signals to both sides, but there's a structure here that's more like a bony type of cartilage type of structure that prevents the muscles from actually sending the signal to the AV node, the atrioventricular node. Slows it down by a little bit. Okay, once you hit the atrioventricular node, you have the bundle of His. Then you have right side and left side. Bundle branches. The bundle branches go through the septum of the heart and basically go to the Purkinje fibers. So wherever there's a signal here, if you notice right here, if the signal gets to the atrioventricular node, it's going to make this muscle contract. And when this contracts, it pushes the bottom part of the heart up. And while it's spreading out, it pushes up and it squeezes in. In other words, like a type of pushing up and then squeezes in. Okay. The musculoskeletal system, you have the primary structures are bones, muscles, tendons, and ligaments. Now, bones themselves are ossified structures, are solid. The muscles themselves are attached. I got disconnected somehow. That's what happens when you pay over $100 per internet. And you have the fiber optics. But you guys are still here, right? I haven't put anybody to sleep.
No.
Yes, sir. We're still here.
Okay, good enough. I'm very glad. Okay, so let's go and continue with this. If you're not here, let me know. Okay, so musculoskeletal system, the bones have attachments of muscles. A bone itself is not going to do anything. It's just a structure. You need muscles to cause it to move. But a muscle itself by itself is not going to do anything. A muscle has to have an attachment point. So let's say if I want to move my arm this way, my attachment points of my muscles are right around this region, and when my muscles contract, it causes my arms to get closer. But when the back portion of the muscles over here contract, it causes it to extend. But if those muscles were not attached to anything, I wouldn't have any movement. And muscles are attached to bones through tendons. Okay? Muscles are attached to bones with tendons. Ligaments hold bones together. Okay? So again, muscles are attached to bones through tendons. Let me get my little magic marker. So muscles are attached to bones through tendons, and ligaments hold bones together, like your wrist bones and whatsoever. They hold it together. And ligaments don't do anything but help the structure, and tendons actually cause muscles to be attached to bones and cause movement. So next time you pick up something to drink, your muscles, bones, and tendons working together. And if it wasn't for the ligaments, all your bones would be scattered all over the place. The musculoskeletal system functions to provide structure, support, protection, and body and internal protection of internal organs. It allows the body to move. Skeletal muscle system produces disease-fighting white blood cells. So most of the white blood cells, including red blood cells, are produced in the skeletal system. So we have all these bones right here. We have it's kind of a small picture. Let me see if I can mark it. Let me just stop. Okay, so basically, we have the skull itself, which is the upper part of the head. Then your facial muscles. We have the maxilla, which is the upper jaw. Then you have the mandible, which is the lower jaw. The only movable bone in the skull area is the lower jaw. Then we have the cervical vertebrae, which is your backbone, and your neck. And your thoracic is connected to the ribs. The lumbar is your intestinal section. Of course, you have your hips, which is your iliums, which you what I consider your elephant ears. Okay. Of course, you have your sacral bones and your coccygeal bones. The pelvis synthesis is the joining of the two elephant ears, which is your iliums. Of course, you have your femurs, which is the longest and strongest bone in the body. Your patella, which is your kneecap. Then you have your tibia and fibula. The tibia is the largest bone, and the fibula is the smaller one. Of course, you have your tarsals, metatarsals, and phalanges. Now, in this section, in the upper arm, you have your humerus, which is your funny bone. Okay. And then we have your radius and ulna. The radius always is facing towards your thumb, and the ulnus are facing away from the thumb. Now, of course, you have your carpals, metacarpals, and phalanges. So you don't get the carpals, metacarpals, and phalanges, and the tarsals, metatarsals, and phalanges. Remember when you drive a car, you drive it with your hands. So it'll be carpals because you're driving your car. And when you go to the beach and you step on tar, you're dealing with your tarsals because you're stepping on tar. I don't know if that makes it easier for you guys. If your bones themselves, you have the skull bones is comprised of the frontal area and the back area. The back area is the skull itself or your cranium, and you have two parietal bones on each side, one on this side and one on that side. Okay. And then you have your frontal bone, which is your frente. Then, of course, you have your nasal bones, your maxilla, your mandible. Okay. The mastoid process is back over here. And the mastoid process is like a little horn that's in the back portion that attaches a muscle that goes from here to the sternum, okay, and the clavicle. And that's the one that actually causes you to do this type of movement and say no or whatsoever. Now, if for whatever reason you break this mastoid process, you'll be walking around sideways because the muscle that's the opposite side is going to contract and it's going to push it as opposed to both of them contracting. Of course, you have your nasal bone. You got your zygomatic right here, which is the lower orbit or your cheekbone. Okay. The temporal bone is right over here, right behind your eye socket. And of course, your orbital bones are right here. And they consist of a couple of them. You have the sphenoid, the ethmoid bone, and a whole bunch of other ones. Musculoskeletal system, you have your axial skeleton. Now, the axial skeleton, let's see who just joined in. The axial skeleton is the middle portion of your no, it's anything that's in the middle. Your skull, your spinal cord, your hip bones, and part of your upper shoulder girdle. And then you have your appendicular, which is basically your upper and lower extremities, shoulders, and pelvic girdle. Skeletal muscles consist of 40 to 50% of the body's weight itself. So if you weigh a lot, it's either you're very muscular or you're fat. It's never your bones. The muscular system itself consists of a lot of muscles that are attached to bones. Your pectoral muscles are your upper chest muscles will be attached to your sternum, okay, and your ribs. And then you have this bone right here that you get to see right here, very little. Let me see if I can actually. You have the sternum right here, sternocleidomastoid, mastoid. So it runs from up here, attaches right here, and then it attaches to the sternum itself. Of course, you have your quadriceps and your legs. You have your gastrocnemius and your lower legs. I don't know if you guys can see this picture. Let me see if I can get out of this picture. It's a lot easier to see it close up. Your deltoid muscle, which is your shoulder muscle, where they give you injections at. Pectoralis major, which is your chest bone itself. There's a sternocleidomastoid muscle. Yeah, external obliques. Now these muscles right here in the stomach run in 3 different directions. Oblique means basically side to side. Rectus means up and down, which is the rectus abdominis. Of course, you have the quadriceps, and then you have your sartorius muscles, the vastus medialis also. And medialis means what? It goes towards the middle. Abductor femoris, which is basically it's a femoral muscle that causes adduction. And we'll go over adduction and all those neat little terms later on. Now, within the muscles, we have 3 different types of muscles. Skeletal muscles that are attached to the skeleton and whatsoever. And then you have your cardiac muscles, which is a part of your heart or the cardiovascular system. And then you have your smooth muscles, which are basically part of your blood vessels in small intestine and large intestine. Blood vessels themselves, the normal blood vessel will be about this much in diameter. Okay, remember that there's smooth muscles right here. Then you have the vasoconstricting, which causes the blood vessels to constrict and causing the lumen itself. And the lumen, by definition, is the inner diameter of the tube itself. Causes it to be a lot smaller, causing blood pressure to go up. It's like when you have a garden hose and you put your thumb in front of it, or you're making the diameter smaller, so water goes a lot faster with higher pressure. And when it vasodilates, causes the blood pressure to go down. In the nervous system, the primary structures is the brain, spinal cord, and nerves. The functions of the spinal system: it controls movement, interprets sensation, regulates body cavities or activities, and generates memory and thought. Which some of us at a certain point, because I'm one of these instructors that doesn't really rest while I'm doing the lecture. But it's a lot of material to cover in a certain amount of time. So a lot of time your memory and thoughts are compromised because I talk for too long. I can go for hours, dude. People don't like me. The nervous system, you have the central nervous system, which is the brain and spinal cord, and the peripheral nervous system, which is basically everything else. And usually the peripheral consists of sensory, and sensory nerves, okay, usually come back to the brain. It senses from your fingers or your toes, and it comes back to the brain to interpret. And the motor goes from the brain to the muscles themselves that you're going to control. So you have incoming nerves coming back to the brain, and you have outgoing nerves from the brain to the body to actually cause movement or whatever. So those are motor nerves, and the sensory nerves are incoming to the brain. Autonomic basically means automatic. You have involuntary processes, sympathetic and parasympathetic. Now, right now, since the intercostal muscles and the diaphragm are working, are you concentrating on telling them, breathe, breathe, breathe? No. How about heart rate? Are you constantly reminding yourself to have a heartbeat, 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 heartbeat? Breathe, heartbeat, heartbeat, heartbeat. You're not, because they're controlled automatically. Now, the respiratory muscles, we can actually control them by holding our breath if we don't get what we want. So we'll hold our breath, turn purple, and pass out. So we have the involuntary muscles, and then you have the sympathetic nervous system, which is your fight or flight, and the parasympathetic nervous system, which is your eat and breathe. Okay, so the sympathetic nervous system will actually increase or decrease and cause you to either get up and want to fight or run away, while the parasympathetic system does the opposite. It makes you want to poop and rest. Okay, so the nervous system is controlled by the brain, okay? And the central nervous system runs through the middle of the body, while the peripheral is towards the arms and legs. Now we have a lot of nerve endings within our periphery, so we can actually detect our environment. Of course, we have in between the vertebrae or the backbone, we have these little structures right here, which is your spinal column. I refer to them as notochord sometimes. That's the same thing, notochord, and the spinal column is the same thing. In the back section, this is what we consider our, oh, I forgot, the appendicular skeleton. No, is it appendicular? Yeah, it's appendicular. We have two internal curvatures, which is in the cervical region and the lumbar region. And most injuries occur within the cervical region and the lumbar region. Okay. The first 7 bones are your cervical bones. So cervical bones are bones 1 through 7. And within those two, the first one and the second one are slightly different. One is called the atlas and the other one is called the axis. C1 is atlas and the axis is C2, while all the rest basically start getting a little bit larger as they go along. If you put your hand in the back of your neck, or right almost in between your shoulders, you're going to feel a little bony protrusion. Okay. And it's basically right this one, what we feel right in this region. And basically that's, well, don't worry about it. It just basically tells you that that's the separation between the cervical and the lumbar. Lumbar are 12 bones. So, I mean, not the lumbar, sorry. The thoracic are 12 bones, which is basically T1 all the way to T12. And then, of course, you have your lumbar, which is L1 to L5, right before you get to the sacrum. And the sacrum itself are fused together, which is where your pelvic girdle is at. It's right before your elephant ears. And then, of course, you got your coccyx. Remember, atlas and axis are C1 and C2. The digestive system, which is the structures of the digestive system, is the esophagus, the stomach, the liver, the pancreas, small intestine, and large intestine. Excuse me, I should have eaten that popcorn. Functions of the digestive system is to break down that burger that you've eaten into small sugars.
Bueno.
Okay. It also removes waste products, because eventually If you eat a burger right now, within a few amount of hours, you're gonna poop it out. And guys are a little bit more notorious than women.
¿Cocas regulares?
Usually, guys tend to want to eat something and they have to go to the restroom right afterwards. And that's because of a peristalsis wave. Peristalsis is basically the way your esophagus is connected to your stomach, your large intestine, small intestine, or small intestine, large intestine, and your rectum. And basically, what it does is once you eat something, the process of peristalsis causes the food to go down, and it goes all the way to your rectum. So the digestive system, your digestion starts at your mouth. Okay, when you're chewing your food, you're mechanically breaking it down. Okay, and then there are little glands that we have here, salivary glands,
¿Cuál es el pin?
that releases and mixes up with your food, causing it to break down a little bit further chemically. Now, once it gets to the stomach itself, okay, right around this region, it mixes up with hydrochloric acid. Then once it gets into the small intestine itself is connected to the pancreas, which is going to release pancreatic juices like lipase and whatsoever. So that's going to cause fat to break down. Then, of course, there's another tube that comes from the gallbladder and your liver, causing bile to actually mix up and it breaks down fats further. The pancreas is more of lipids. Well, I want to say lipids, proteins, and the gallbladder is more of what do you call it? Fats. So let's see if you go to the restroom, and guys, this is a diagnostic tool, believe it or not. We'll ask. I mean, if you haven't been asked, then you might not be getting a full assessment by your doctor. But if I ask you, when you flush the toilet after you poop, do you flush it several times so all the poop can go down? In other words, do you have floaters? Because if you have floaters, you have too much fat in the what do you call it, the stool on your poop, and it prevents it from flushing right away. So that means that you might actually have a problem with your liver or your gallbladder. Okay, and then you have the pancreas and gallbladder right here, kind of depicted a little bit, not showing how it's connected. Of course, you have your large intestine. It basically goes. Where's my mouse? Okay. Goes this way. The small intestine gets the food first, then it goes to your large intestine, which is basically stored. Now, the small intestine tends to absorb the nutrients. The large intestine tends to hold and regain some water or release some water. If you have too much water in your stool, guess what that's called? Diarrhea, cha-cha-cha. And if you don't have enough water, constipation, cha-cha-cha. So one of those diagnostic tools that we use, not a lot of people use them. It depends on the specialty that you actually go to. Okay, now you have the reproductive system, and the structures. You have the males, you have the testes and penis, and the females, you have ovaries, fallopian tubes, uterus, and vagina. Functions of the reproductive system is to produce hormones, and the female reproductive system produces different hormones than the male reproductive system. Okay, now the female reproductive system also produces hormones to actually keep gestation and development intact. If they don't, then they might actually not maintain a baby and produce an abortion. The male reproductive, again, you're dealing with a testes, okay, which basically produce sperm and hormones, which basically have to go through a little tube go through the prostate itself, which now has seminal fluid and actually causes an ejaculation and causes a female to become pregnant. While the female reproductive system is a little bit more complicated. It's got ovaries, okay? These are the ovaries themselves, which releases an egg and causes it to go into the fallopian tube right here. Then eventually, if the testes release sperm and the female egg come in contact right in the fallopian tube, then the egg will actually travel down into the inner lining of the uterus and basically implant itself. And with hormone changes, that will actually cause pregnancy to occur. Okay. The urinary system, the structures are the kidneys, ureters, bladder, and urethra. The kidneys themselves are located in the back portion of your body, and they actually filter out blood and clean out blood and release urine, the toxics. The ureters transport that, did I say blood? Well, no, the urine itself transfers the urine from the kidneys to the bladder, and the urethra causes the fluid to go outside of your body. Functions of the urinary system is to remove chemical waste products from the body itself. Okay, it helps balance water and salt levels in the blood. And the urinary system consists of your kidneys, the ureters, which is the tubes that come out of the kidneys and connect to the bladder where urine is collected. And eventually you have your urethra, which basically is a little tube that causes you to urinate. And in males is a little bit longer than the females. The integumentary system is your skin. Okay? And it's usually the skin, nails, hair, sweat glands, oil glands, and the mammary glands. Okay, the skin itself is the largest organ in the body. So if I tell you your epidermis is showing, that means that the outer layer I get to see. It's the largest organ in the body. It actually controls heat by causing sweating or by causing shivering or whatsoever. Sorry. So then you have dermis and subcutaneous. These are two different layers of the skin itself. And we're going to have to know these for the simple reason that when we're classifying burns, we need to make sure that up to what level did the person receive the burn. At the epidermis itself, if it's just red, then it's a first degree. Once you start having little blisters forming, it's a second degree. And once you start getting black portions of it and lack of feeling to that burn past the blisters, then you have a subcutaneous or third degree burn. Of course, there's also a fourth degree burn, which is electrical burns, because electrical burns happen from the inside to the out. Houses, there's basically also houses the structures of the integumentary system itself. Functions of the skin is protection from toxins and environment. So the skin needs to be intact. And whenever they receive a cut, then we need to make a barrier for them. So we put 4x4s or gauzes on them so they don't get any more infection. And it regulates the body temperature by releasing water or sweat. Sensations, temperature, and senses, cold, to touch, pain, or pressure. And then you have regulations of body fluids and chemical balance also. So these are the three different layers. The dermis itself is what you get to see. The epidermis is right below that. Okay. Then you have the subcutaneous layer. And right below the subcutaneous layer, the subcutaneous where your glands and blood vessels and whatsoever are that. The endocrine system is the primary structure. Primary structure of the endocrine system is your thyroid, pituitary, adrenal, pancreas, and gonads. The adrenals are sitting right on top of the kidneys. like a little beanie for the kidneys, and they produce epinephrine. The pancreas itself produces insulin. Now, it also produces a couple of other things, but the main one is insulin because it also produces growth hormone and it also produces a couple of other chemicals. Specifically, you know, if we're talking about the islets or Langerhans, which are little clusters of cells, then we have these. But then if we're talking about gastrointestinal juices or something to help in digestion, it's produced by other cells, in there. Of course, your gonads are your testicles and your ovaries. The endocrine system functions, metabolism and regulation, physical size and strength, hair growth, voice pitch, and reproduction. Basically, that's what the whole endocrine system controls. Okay. So the endocrine system regulates hormones. Specifically, you know, if you're dealing with this one, which is your pituitary, you have an anterior portion and your posterior portion, and those release a certain amount of chemicals, including prolactin, which is used for it's a prolactin stimulating to produce milk production in breasts when a female gets pregnant. We also produce ADH, ADHD, antidiuretic ADH, which is antidiuretic hormone, which causes us to urinate or not urinate. Of course, you have right here, what you get to see is the thyroid, which they refer to as a mariposa. And that actually releases a certain amount of chemicals to maintain calcium and metabolism. Then you have the thymus gland. Now, the thymus gland is located in kids. At a certain age, it disappears, but it's located right behind the sternum itself. And the sternum is your breastbone right here. I don't know if you guys get to see this. It's a breastbone that's attached to your clavicles. Now, once you're an adult, you don't have a thymus gland anymore.
No here.
The adrenal gland itself is located right on top of the kidneys. Okay, and it's like a little beanie for the kidneys. Now, ovaries produce certain chemicals or hormones that actually regulate a female's reproductive system or puberty hormones, which actually causes a female to become a female. The pancreas itself, it's an organ of digestion, and it also helps insulin production because it releases insulin to the body and glucagon to the body. It also releases growth hormone. And the testes release male reproductive system hormones. Lifespan and development. I know this is going to be a long chapter, and I apologize. We'll just finish with this one. Lifespan development. Yeah, biological. You have physical body. Cognitive is usually considered the mind, and psychosocial is how the person actually interacts with other people and their surroundings. Okay. Developmental stages. You need to memorize these. Neonates are from birth to 28 days. Some books will tell you 30 days. Infant is from birth to 1 year of age. A toddler is 1 to 3 years of age. Preschooler is 3 to 6 years of age. And school age is 6 to 12 years of age. Now, this showing 3 generations of girls, I guess. Grandmother, mother, and daughter. Now, guess who paints their hair? Genetically, she's not blonde. The daughter's not blonde. Somebody's blonde. I guess you have to be there. Developmental stages. Adolescent. Now, this is past the school age, which is 6 to 12 years of age. Adolescents are 13 to 17 years old. and adults is 18 to the end of life. Now, of course, you have your primary adulthood, which is geriatrics, and that usually is like from 50 or 60 years old and above. Neonates from birth to 1 year of age, sensitive to cold temperatures, separation anxiety, and visual assessment, most productive. Toddlers themselves is 1 to 3 years of age, sense of independence, they have stranger anxiety and separation anxiety. It's normal stages of child development. Okay, preschoolers, 4 to 5 years of age, they have concrete thinking skills, needs reassurance, responds well to simple explanations. You have also separation anxiety, begin assessment with extremities, then trunk, then head. And whenever you're doing your patient assessment on kids, you start from the feet to, it's instead of head to toe like in adults, it's toe to head. You go backwards, only because, well, they don't know you and you're touching them. Are typically quiet and modest themselves also. School-age children are 6 to 12 years of age, basic understanding of body and its functions. They're able to communicate and understand more complex ideas, often take what is said very literally, and are aware and afraid of death and dying, as well as pain, deformity, blood, and permanent injury. Adolescents, 13 to 17 years of age, they understand anatomy and physiology, able to process, express complex ideas, risk takers, poor judges of consequences, afraid of disfigurement, permanent injury, often believe they are immortal. Kids at that age believe that nothing can hurt them. They also believe that they're indestructible and want to actually they want to be treated as adults. Early adulthood, which is 18 to 40 years of age. It's basically you have your peak in health, very active, make up a large number of those involved in traumatic injuries and accidents. Okay, middle adulthood is 40 to 60 years of age. It decreases in the ability to see and hear well, decrease in height, hair begins to turn gray, you have permanent wrinkles appear in the skin itself. Late adulthood, 60 to the end of life. You have a declining ability to see, hear, taste, smell, mobility difficult for some, awareness of own mortality, an decrease in ability to perceive pain, often have overlapping illnesses, and you have multiple medications. And you're talking about diabetes, hypertension, and a whole bunch of other ones. For this chapter, let me just, okay. Give me a few seconds, guys. Let me see if I can. Oh, this one is. Let me see if we have time. Oh, yeah, we have a lot of time. Let me see. Now, this next chapter is chapter 5, and it's the introduction to pathophysiology. You guys want to take a 5-minute break? Anybody?
Yes, sir.
Okay, let's take about 5-minute break, and then we can come back.
Thank you.
Okay.